At the time of the World Trade Center, there was really only a little bit of evidence for one particular treatment, that's exposure therapy, and at the time it was mostly with interpersonal assault. Um, but after the World Trade Center, we knew thousands of people would likely develop post-traumatic stress, and we needed to start somewhere. So we had our clinicians trained in exposure therapy, which is a cognitive form of cognitive behavioral therapy in which you go over your trauma as if it were happening again in the present tense and in the safety of your therapist's office. That's very key. It takes about 9 to 12 sessions for people who only have post-traumatic stress disorder without a comorbid depression or personality disorder or history of trauma to get better. And so we start with that as the first line treatment, but there's a significant number of people who don't respond to that, depending upon whose study you look at, maybe 25, 30%. And so after the World Trade Center, again, knowing that there would be a significant number of people needing treatment, we decided to engage in using virtual reality simulations of trauma. It's been shown at that point to be effective for some phobias like fear of flying and fear of heights and crowds. And the treatment for phobias is very similar. It's a form of exposure therapy. And so we created a simulation of the World Trade Center. And what happens is when you put on, it requires a 3D computer software program and a head-mounted display. And when the patient puts the head-mounted display on, they're actually seeing the scenario of the World Trade Center, and then they're able to narrate their trauma memory. And we find we think probably that for people who are more avoidant and numb, it will end up being the treatment of choice once all the data is collected. We know now that it's effective and that people who are offered this treatment get better. We don't know which form of exposure therapy is best for whom. And we also don't know, I mean, there'll always be some people, whether it's for PTSD or any other medical condition, that don't respond to the first line treatments. And so another aspect of our work is looking for genetic predictors and trying to determine in advance who will respond to what treatment.